The many faces of diagnostic and therapeutic radiology are called subspecialties. A radiologist training now includes a 5-year residency program after medical school, and many of the LRA physicians have an additional year of training or a fellowship year in a specific subspecialty of radiology.
Interventional radiology is really a broad subspecialty, and it encompasses a whole host of different procedures on a whole host of different patients, including pediatric patients all the way to geriatric patients and everything in between. It's really a vast specialty, and it includes all other specialties as well, from primary care to neurosurgery, cardiovascular surgery, all the way to gastroenterology and urology. Interventional radiology is used in a variety of ways as ancillary services or as a primary service. The ancillary service is a service line that we offer along with other physicians and other medical personnel in a collaborative effort to try to take care of patients. And oftentimes the ancillary service aspect of interventional radiology includes common procedures like lumbar punctures or core biopsies, or perhaps getting access to veins. The more advanced therapies are typically primary procedures, and those include vascular interventions such as angioplasty and stenting, or treatment of cancers with minimally invasive techniques to try to not only palliate cancer, but also cure it. These procedures are typically performed on outpatients, so patients come into the hospital and leave sometime later the same day. The fascinating thing about it is we use some of the advanced imaging modalities, be it CAT scan or real-time X-ray or ultrasound or some combination of these different modalities. So we use state-of-the-art fluoroscopy equipment, which is angiographic equipment that helps us guide catheters and wires to various spots throughout the body, and we typically guide these catheters and wires through different blood vessels depending on the condition. But we also perform oncology procedures whereby we can treat tumors within the body by either burning them at high energy with a radiofrequency ablation type probe or freezing them with a cryoablation type probe. Those are two of the main technologies that are really state-of-the-art treatments for cancer therapy. Interventional radiology is really about patient choice. We provide a whole host of services to these patients, oftentimes with short recovery times, very safe procedures, and most importantly, outcomes are better than or comparable to traditional surgeries.
An MRI machine is completely different than, let's say, a CT scanner in that it doesn't use any radiation. So actually what it represents is an extremely powerful magnet. In fact, it's about 30,000 times more powerful than the Earth's magnetic field. And essentially what happens is we're going to take somebody and make sure they don't have any metal on them, because like any magnet, it attracts metal. And once they've been cleared to go into the magnet, they just basically lie still in the magnet. And usually an exam would take perhaps about 30 minutes. Usually we acquire somewhere on the order of about 300 to 400 images of the patient. And what we're actually looking at, for the most part, is their water molecules in there. So although we don't use radiation, what we're actually doing is we're changing the orientation of their water molecules, and that allows us to have sort of images that can be anything from how well blood is flowing to what their actual brain tissues look like, or let's say whatever their liver looks like.
In radiation oncology, we are using X-rays to cure patients as opposed to diagnosing patients in the radiology department. So the doses are substantially higher. When the patient first arrives in our department, we usually do a complete history and physical examination. And in conjunction with other specialists who are treating that particular patient, we formulate a treatment plan with the help of dosimetry and the excellent physics department that we have here. We outline the treatment. We can treat with radiation therapy given at a very close distance from the tumor, that's called brachytherapy. Or we can use external beam radiation therapy, which is usually called teletherapy, which is a radiation treatment given from a distance. Lancaster General has a tomotherapy unit. It is the only unit in this area. We are able to offer patients a very focused radiation therapy. By focused radiation therapy, the side effect profile of treatment will definitely be lower. It will allow us to maximize doses to the tumor-bearing sites. What's exciting about it is that we can escalate our doses that tumors receive with minimal side effects. We are able to treat lung tumors in large fractions and complete treatment at a faster rate. I feel that patient understanding, patient comfort, and successful outcomes are what's important.
Lancaster Radiology Associates and Lancaster General have developed an unprecedented partnership. LRA has experienced an enormous growth, which has allowed us to attract a diverse and highly skilled group of doctors. This collaboration is a testimony to the mutual trust and respect that allows Lancaster Radiology and Lancaster General to rise above and beyond the call of medical duty.
The hospital came to us and said, we'd really like to work collaboratively with you to buy a new system for reading our x-rays. We probably read close to double the number of studies, and each one of those studies has many more images than previously. We spent a great deal of time working together. We traveled to see the system in various sites. We brought the systems in to test and demo in our department. It was a clearly mutual decision to pick the vendor that we picked. The ability of the system to load the images much more quickly, to allow us to start viewing them and begin making a diagnosis in a much more efficient fashion is really a huge plus.
We provide in-hospital coverage for the emergency room 24 hours a day, 7 days a week. It's important to have a radiologist at the hospital to provide guaranteed prompt service coverage to our patients and our physicians, and an individual who is available to talk face-to-face to physicians and patients if needed.
Lancaster Radiology Associates is committed to giving back to the Lancaster community and to Lancaster General.
Lancaster Radiology Associates does have a rich history of philanthropic support to Lancaster General Health. They're the leading physician group in terms of philanthropic support, and they're one of the only physician groups that makes a year-end gift. Dr. Hoke, since he was a leader in numerous medical kinds of societies within the hospital, we also recognized him in Society Generalis, where we recognize excellence in medicine, excellence in community support and volunteerism, excellence in board service, and excellence in philanthropy.
Patients that are members of PALCO, when an x-ray is ordered for them, they get the x-ray free of charge. There's no technical charge, there's no professional charge, and that's been really beneficial to the patient. Before, if they didn't have insurance, they may not be able to get that MRI, and then the treating physician would not know the appropriate treatment. Lancaster Radiology has been a major participant. In fact, last year, 2009, they received an award as the Volunteer Physicians of the Year award from PALCO because they had taken care of the most patients and had contributed the most in financial services.
The Andrew Koch Radiological Technology Scholarship Fund was established in 1997 and was established by physicians of Lancaster Radiology Associates. And it benefits a student that's a radiation technology focused student at the Lancaster General College of Nursing and Health Sciences each year. The scholarship reinforces the strong relationship between Lancaster Radiology Associates and the hospital, and in this case, the college.
We had a lady who she's in her 50s, she's bleeding rapidly. We did endoscopic studies on her. We knew that she was bleeding. We couldn't locate where she was bleeding from. We did a nuclear medicine imaging study. With a lot of time and a lot of care, a lot of expertise, Dr. Leslie was able to isolate a vessel that this lady was bleeding from, and he was able to put a couple little stents in there to block the flow of the blood to this collection of vessels, and the lady stopped bleeding.
Our radiology group has done a great job in staying up with the technology and recruiting, more importantly, recruiting highly skilled and interested physicians to be able to help us solve these very difficult problems. I can tell you as a pulmonary physician, I am a better physician because of the skills and collaboration that exists with the Lancaster Radiology Group and our practice.
I believe in Lancaster Radiology Associates.
I believe in
I
Lancaster.
believe in
Lancaster.
Lancaster.
I believe.
I believe in
I believe in the future.
I believe in the future of Lancaster Radiology Associates.